Welcome to Inside Aesthetics, the world's leading podcast for injectors and aesthetic businesses. I'm Dr. Jake Sloan, an aesthetic doctor with over 16 years experience in facial aesthetics.
And I'm David Siegel, an entrepreneur and business mentor with over 20 years of experience in our industry. Our podcasts are aimed at industry professionals, and any information or advice given is general in nature. You should consult with a healthcare provider before undergoing any treatment.
You can also subscribe to us on Patreon for on-demand content for injectable and business education. Just before we get into the podcast, we just want to thank AnteAGE and the team in California for sponsoring this podcast. We really appreciate your partnership.
Well, it's been a while since we've done a regenerative medicine podcast.
Exciting.
I'm excited. I know. It seems like this is where we're going. I was just talking to you this morning at breakfast. I was having a chat with some clients over in Europe last night, and the amount of excitement and money that's being poured into the regenerative medicine industry and this union that we're starting to see unfold between aesthetics, anti-aging, functional health. It's a really exciting space. So I'm very excited about this chat. But before we jump in to that discussion today, what's happening with the podcast? What's news?
Podcast news. Well, firstly, this Friday, we're announcing our biggest ever competition, which is quite exciting. By the time this is out, we would have already announced it. So we're flying a winner all the way to Switzerland for the Inner Circle event held by Dr. Felix Bertram. We'll obviously give you a ticket to the event itself. There'll be a 6-course dinner at his 2-star Michelin restaurant. All of the social program, everything, that's all on Felix and us.
Wow.
So look at the bottom of our podcast description for the details of how to apply. Stephen, you're not allowed to apply, sadly.
Okay.
And
I know him, though. Maybe I can get a...
Yeah, maybe you could get a 51st ticket, maybe. Then in terms of our IA offers, I don't know if you guys know, we have offers from partners and sponsors. We've got 2 big ones to announce.
Yes, exciting stuff.
So who are Clinical Imaging?
Clinical Imaging is a company owned by Woodrow Wilson, not the former US president. He's a photographer located down in Melbourne, and he's essentially the go-to guy in our industry in Australia for clinical photography. So something that we speak about a lot in the podcast is the importance of clinical photography. Obviously, we've got a lot of eyes looking on us at the moment in terms of the quality of photographs and doctoring images. And at the end of the day, I think it's been a portion of our space that's been overlooked. People capturing photos on iPads and mobile devices. Okay, but that's not really how you want to showcase your work. I mean, I see what you guys do, what guys and gals do as an art form. And so it should be captured in a high quality way. And Woodrow's got an amazing system that he comes in and sets up a completely seamless configuration within your clinic to make capturing your clinical images fantastic. And we've actually just partnered with him.
Yes. So all the information, of course, is down below. But if you go to our IA offers link and then quote the code IA10 when you connect with Clinical Imaging, when you first contact them, you'll get 10% off any of their photography packages, which is pretty good. It's an investment for sure, but it's worth it. I know Stephen's got Clinical Imaging in his clinics. I've got it in my clinic. It's fantastic.
If I had a clinic, I would have it.
Yeah, but also to showcase some of the skincare results that we're going to be talking about. I think high quality, high resolution photography can't really be ignored.
Yeah.
So that's one of our offers. The other offer, this is more specific for Australian listeners. We've partnered with a company called PHILM. That's PHILM.
Yeah.
They are a creative agency that are amazing with obviously photography, but also moving imagery and videography.
Yeah.
So if you want to capture some headshots or, clinical imagery or do something with your team or anything for branding and marketing.
Yeah.
I think
socials as well.
Socials, true.
Again, so Woodrow's obviously taking care of the clinical imaging relating to patient results, and PHILM take photos of your clinic, your staff, video content for social media. Actually, he was at your conference, Stephen, A23. He was there. So yeah, small world.
Scott Eller is the name of the photographer who set up the company. Anyway, same offer again. IA10, if you contact PHILM, information is down below. You get 10% off any photo shoot, including team photos, headshots, etc.
And quick Patreon, what's happening this week?
Oh, what's happening this week? There's lots. I actually had someone shadowing me in my clinic yesterday, one of our Patreons. So we captured some content about ultrasound, looking in her face, talking about safety when, performing injections, obviously. We spoke a little bit about anatomy and so on. So we've captured some content for our Patreon.
Yeah,
there.
And I did another maximizing retail sales opportunities with Cassandra Smith. So last week I put up we showcase one of my clients from Mudgee in Australia and going around her clinic and looking how she's got it set up in terms of maximizing it to take your patient on a journey, how to showcase and sell retail products within your clinic. And I did another one with Cassandra this week with one of my clients from Melbourne. So exciting stuff. It's actually quite visual. You get taken around the clinic, shown what should move, where's the patient, where's the patient's eye drawn, how to showcase particular products that you want highlighted within your space. And it's something that I guess as business owners and clinicians, it's something we don't really think about.
No.
So yeah, interesting stuff.
Fantastic. Well, that's the news out the way. Let's introduce our special guests. We've got all the way from California, Ian Sanderson, president of a new company called AnteAGE. We'll get onto who AnteAGE in a sec. And then we've got our friend, Dr. Stephen Liew, been on the podcast several times before, plastic surgeon from Sydney. So Ian, let's come to you first. Do you want to introduce yourself, tell everyone about your company, what you do, and your product range, I guess?
Yeah, absolutely. Thanks for having me on, guys. I'm Ian Sanderson. I'm the president of AnteAGE, and we're new to Australia. We've been there for a year or so, but we've been making growth factor-based products, stem cell-based products in the U.S. for about 13 years now.
Right.
So we've been around for a little while, working on the science and the product development side. We're in many thousands of clinics in the U.S. We're in Middle East, Europe, Southeast Asia, and now we're in Australia as well.
Fantastic. And your role as president, like when did you join the company? Did you found the company? What's your role now? And just tell us about your background, I guess.
Yeah, absolutely. So I did help co-found the company 13 years ago. So my father is a doctor scientist who really fell in love with what bone marrow stem cells could do regeneratively in the body, and decided to explore how that could be applied to cosmeceuticals, skincare, things like that. So it started with some newer science around bone marrow stem cells about 13 years ago. And so he asked me to come along as kind of the business end and to help support the commercial side. So that was 13 years ago. I've been the president of the company, I think, for 8 years now. And it's been a really fun, exciting, wild ride. My background is business. It's not necessarily medicine and science, but the last decade or so, I've picked up a lot of that, and just try and learn as much as I can from brilliant doctors like Dr. Liew and all the doctors that I work with at AnteAGE.
And how did your dad get involved with playing around with bone marrow stem cells? What was his background?
So he as I said, he's a doctor scientist. He was actually a medical director at Johnson & Johnson, looking into regenerative medicine at J&J. But this particular track wasn't interesting to J&J, and he got really excited about bone marrow stem cells, their regenerative ability. There was a lot of science being done actually here in California in the UC system, lots of papers being published. So he just couldn't let it go and decided to start a company to commercialize products that would take advantage of the new science.
Fantastic.
Yep. Stephen, I know you've been on the podcast, as Jake mentioned many times before, but just to give people who maybe haven't tuned into your previous episodes, just give us a little bit about your background, who you are, and particularly your interest in regenerative medicine. You're sort of always on the cutting edge of what's new. So keen to hear about that as well.
Hi, guys. Thank you for having me. Hi, Ian. I'm a specialist plastic surgeon based in Sydney. My interest in surgery is in the aesthetic surgery of the face and breast, and I also have a keen interest in the non-surgical world. My interest in regenerative medicine probably stemmed from about 30, 40 years ago when we start talking about intrauterine fetal repair. When it was the first successful, there was a really true scarless surgery, and that interests me because as an aesthetic plastic surgeon, most important thing is you want the patient, when you do some surgery, you want them to have a scar that is not noticeable. And how good will it be if we can truly do it with no scar? Now, clearly, we're not there yet. Now, clearly, anything in adult, whenever there is a repair of any wound, it's going to be a scar. So whenever there's a regenerative ability, hopefully we can minimize the scar. And that's why we're here today talking about how we can minimize it.
Fantastic. Now, what do we mean by regenerative medicine, Stephen? Like, what does that concept mean to you? Because there's a lot of things being thrown around, spoken about. I'm sure you've tried some of these in the past. Many things promised the world and some didn't deliver. So what do we actually mean by it?
I think it means a lot of things. It generally means you are able to supercharge that environment, and I think it has to be the extracellular matrix, where there's so many components of cytokine, any signaling, intercellular communication, to be able to generate the best environment to lay down collagen in a lasting, in a regenerative manner, rather than going through the inflammatory process. And I think that's what I mentioned. Inflammatory process result in repair. Regenerative process it result in something that looks very natural. So a young baby has a beautiful layer of collagen, whereas an adult, the collagen bundle are very, very different. So we know that the power of stem cell, we know the power of fat grafting and all that stuff. And I think that's why we're excited when exosome came out. Ian's going to enrich us about exosome. For me, there's multiple definitions. For me, it's almost like me sending you a check, a text. Inside that text is a different content. And that's why it's so exciting. And then I'll give you an instruction through text. You just go and carry out what that instruction is. That's how my simple understanding what exosome means. But I'm sure Ian is going to enrich us on that.
I got one more question for you, Stephen. What term do we use for this kind of stuff? Is it pro-aging? Is it anti-aging? What is it? It gets a bit controversial. Some people don't like some of these terms. So what do you use?
Listen, aging process is a bitch. Okay, let's face it. There's no such thing as growing old gracefully. I think we're just going to keep with ourselves. I never believe in pro-aging. I think if we're going to do something, we're going to really, really, treat aging process as a disease. Because, every time we talk about anti-aging, people think about just our appearance. Well, that's important. But aging process involves degenerative of every single organs in our body, our brain and everything. So I think, if we embrace aging, it means that all of us are going to end up demented. All of us going to end up with urinary incontinence. I certainly don't want that. I'm sure none of us in this. So I think we should actively, aggressively deal with it. Yeah. That's my stand on it.
Yeah. It's interesting, isn't it? Because we're sort of seeing this collision course which has arrived where patients and clinicians have actually started to pull back, I guess, from over-exaggerated aesthetic outcomes and patients becoming more, I guess, empowered with how they want to look and what sort of aesthetic they want. And then this regenerative sort of leap forward that we've had where these products are now available, where, people are thinking about biostimulation, anti-aging from, a cellular perspective. So it's really interesting, the timing on how these things have sort of started to collide at the same time. And if you could just maybe take us back, let's sort of look at this from 1,000 feet in the air. We've been hearing about stem cells for the last, 10, 20, 30 years about, this is the holy grail. This is what's coming. It's going to be amazing. It's going to change the way that, that we look at the human body and what's possible. And there's been a lot of issues with, ethics and, how do we stop these stem cells from sort of to switch them off once they start doing what they're doing. So where are we at in terms of stem cell technology, and sort of where do your products kind of sit in sort of the offering and how we're going to deliver this to the masses?
Absolutely. I love that question. So there is so much promise in what stem cells can do, right? They're really powerful cells. And the kind of stem cell that we look at and we can harness to deliver benefits is this bone marrow stem cell. And we actually now use some other stem cells like umbilical, but technology is around the bone marrow stem cell. But we can't ethically give you a live bone marrow stem cell from another person with another person's DNA and say, okay, we're gonna surgically implant this live stem cell into you. That's not something that any Western country allows, and it's also we think it's just it's suspect, but the power of what that stem cell would do in you, hopefully in a best case scenario, is deliver these biosignals, these cytokines, these growth factors, these exosomes. And those proteins can be isolated And those are not unique to any one individual. They are a common language that our cells use to communicate. And so Dr. Liew's exosomes can talk to my cells, and I don't need his stem cells, right? And I don't necessarily need a stem cell from a baby. I can take a stem cell from a healthy young adult, and I can get those growth factors and those exosomes that actually speak to adult cells. And that's actually something that's important in regeneration of the adult skin, is that we want adult communication, because sometimes fetal communication is good, like with scars, for instance. There's some really good anti-scarring communication that happens there. But for the most part, we want adult healing and regeneration. And so that's why we use these adult, 18 to 20-year-old adult bone marrow stem cells. So that's kind of the magic and the power that we harnessed 13 years ago, is taking these exogenous growth factors from a stem cell conditioned media and using them in skincare products that people can use daily, using them in treatment products that can be combined with microneedling and RF and laser. And the whole idea is to harness the signals, as Dr. Liew said, those text messages, to get the signals, but we don't need the whole cell. And that's really, I think, the core technology that we're still excited about. Now, we do new things today with exosomes and whatnot, but it's all part of the same magic of taking those really smart signals for anti-aging from a stem cell, but delivering them without a cell involved.
Right. Can you just sort of break down some of the technical terms? I know that some of us listening to this will be educated in this space, but many aren't. So when you say cytokines, stem cells, exosomes, I think there was another technical term that you threw in there as well. So can you just give us some basic definitions about what all these different names mean and how you're using them differently? Yeah.
So the stem cell, of course, it's a cell that is a progenitor cell that could become different kinds of cells. But our bone marrow stem cells in particular are really cool because they actually live in our bone marrow. They travel throughout the body, and they are the natural stem cell that is responsible for adult healing in most tissues. So that's our stem cell. It's like a really, really smart little mobile brain that goes wrong and heals. And it heals using cytokines and growth factors. So cytokine is just a cell signal. So a cell signal could be a growth factor. It could be other types of signals. So cytokine is just like a higher level term. A growth factor is kind of the most common signal type that is going to be orchestrating different processes in our tissue and in particular our skin. So there's growth factors that are really well characterized, really understood, like VEGF, vascular endothelial growth factor. VEGF is responsible for making sure that we've got the right blood flowing to the right tissue areas, and that's especially important for hair. When we lose hair, a lot of times it's because we have a lack of blood flow, lack of nutrients. So VEGF is actually the most important growth factor that regulates the process of growing hair. But then we have things like TGF-beta-3, which is the scarless wound healing growth factor. And so this TGF-beta-3 is what is most indicated with scarless healing when we study what growth factors do and what their role is. So again, these growth factors, these proteins, they're chains of amino acids that are signals that our cells recognize. They take those signals in and they change their behavior based on receiving these signals. So this is a whole class of ingredient that can be used in cosmeceuticals. And this is very different from something like a vitamin C, right? Vitamin C is going to have a stimulatory effect on the body, but it's not necessarily it's not a cell signal in the same way. It's more changing the environment that the cells will respond to. These proteins, these growth factors, are actually the exact signals that a cell is looking to receive. And so it triggers a very specific cascade of action within the skin.
Right. Thank you. Couple more questions. I hope you don't mind. So when you've got stem cells, they can come from different sources. So you're talking about bone marrow stem cells. You've got umbilical stem cells. There was stem cells in adipose tissue as well. And then I've heard about things like mesenchymal stem cells. I remember listening to a Joe Rogan episode a couple of years ago about a clinic down in Panama. All the athletes like Kobe Bryant and all these high-profile athletes were going down there and getting these treatments for horrific career-ending injuries potentially. So where does the bone marrow fit into all the different sources, and why have you chosen that one as opposed to the different places where you could source stem cells from?
Yeah, absolutely. So bone marrow stem cells actually are mesenchymal stem cells. Okay. So it fits into that class. So it's the same thing.
Right.
We can get cells from the umbilical cord, from the placenta. We can and you can actually get mesenchymal stem cells from that source as well. You can get stem cells even from the blood. You can get stem cells from many different tissue types. Most of our tissue types have specific niches of stem cells. But when we look at the immune system and the system that is most responsible for regeneration, well, where does our immune system and our blood come from? It comes from within our bone marrow, and it's actually these bone marrow mesenchymal stem cells that are the most potent kind of generators of regenerative growth factors. So that's why we really like that cell type. And you can go look up thousands and thousands of papers that have been published in universities on bone marrow stem cells. They're very hard to work with. That's why it's a lot easier to work with adipose-derived, with fat-derived. Fat-derived are very abundant, but they have a different profile. So when you culture fat cells, they're going to produce a different set of signals. And we just really like, for everything for aesthetics, for everything for that regenerative ability, we really like what bone marrow does in terms of that signal profile. So again, they're all text messages, but what is actually being described in the text message from these bone marrow stem cells is really ideal for aesthetics, whether it's pairing with lasers, microneedling, skin rejuvenation, hair rejuvenation. We really like what we can do with the bone marrow.
Stephen, I've often heard you say on stage, I'm just a simple surgeon. I don't understand a lot of these technical terms. So how would you sort of summarize what Ian's just said? And I guess, how is that practical to you as a surgeon as well as an injector?
Well, first of all, I think, as I said, I'm still a very simple plastic surgeon. And what Ian has just described in an eloquent manner is almost like you have a bot that sent 1 million text messages to you today. And each of that text messages are instructing each part of your cellular component to do slightly different things. Mm-hmm. That's probably what exosome is doing. It's still in its infancy, and no one can claim we fully understand all these growth factors. And Ian mentioned a few of the one that is crucial. We need blood. We need abundant blood supply. We also need, to talk about how wound healing can happen. And those are crucial in what I do. And if you have all this signaling coming in to try to orchestrate something that is so complex that none of us fully understand, and I think that is a good start. And I'm sure that Ian will also agree that none of us has actually be able to actually decipher what really truly going on at the moment. But this is a good start.
Fair enough. Ian, I don't know if I missed it, but did you also define exosome as opposed to a growth factor? I'm not sure if we covered that.
Yeah, let's get into that. I think that's the hottest topic certainly in regenerative aesthetics right now is exosomes. And, exosomes come from the same stem cells that we grow in our lab here in California. I'm actually about 20 feet away from the lab where we grow these stem cells. And these stem cells will produce growth factors. They'll produce exosomes. But for a long time, those exosomes are very difficult to preserve and actually get from my lab here to the patient, right? So this is our treatment solution, our growth factor solution that's been around for 10 years now. And in this vial, this 2 ml vial, is our stem cell conditioned media. So it has growth factors. It also has exosomes, but we weren't before able to preserve those exosomes. So let me define what an exosome is. An exosome is part of the way that the stem cell will communicate. And it's a fat bubble. It's a sphere. It has a phospholipid bilayer, and it's almost like a miniature cell. So the stem cell actually sheds a little bit of itself, and it creates this little bubble out of its phospholipid bilayer, and it puts inside of it all these really, really important smart signals, including microRNAs and growth factors and cytokines. And what it's able to do then is it's able to send that bubble directly inside of another cell. So I like to define this as a high signal to noise ratio. So if you think about tuning a radio, old radio, maybe you're on the AM spectrum and it's really fuzzy. and you've got a lot of kind of static, right? Well, if you're just sending stem cell conditioned media out, you're going to hear something, but you're also going to get a lot of static in there. If you're able to isolate the strongest fraction of what that cell is communicating, that's what this is. This is our exosome solution. And so this is a preserved, concentrated, just the most concentrated signal that we get out of that bone marrow stem cell. That's what an exosome is. So anyway, it's these bubbles that are full of hyper-concentrated signals, and that gets you kind of more to digital, right? So as opposed to tuning that AM radio with some static, we get to a digital station and we don't have any static anymore. And that's really the transition that the whole industry of regenerative aesthetics is going through right now, is getting the right signal from the right source, putting it in a preserved exosome so that you get rid of the static. And in that way, you really get, hopefully, the most ideal outcome for the patient, whether we're doing a chemical peel or we're doing plastic surgery or we're doing microneedling or laser. We want to give the very best signals from the best source for the best outcome with minimal noise. And that's where we get with exosomes.
See, if you think about it, this is a leap forward. Think about in that horrendous 2 years when we all got locked down. Think about the vaccine, the messenger RNA vaccine. Did you think that was so smart? You're able to get into the human cell with that parcel of information, that messenger RNA, to create that antibody for a specific virus. And that's how, in a simplistic way, I think about this thing in a vial. You're just sending that information to our existing body and say, hey, do this.
Yeah, that makes sense.
And I think it's important to also note that what we're doing is we're concentrating the body's own natural, healthy, young signals. So we're not doing any creation of new proteins here. We're actually just taking the proteins that the body produces in high levels when we're young. And we all know that when we're 18, we look pretty good. Our skin looks pretty good in general. Maybe, we're just getting past the acne phase. But in general, we have healthy skin that heals. If you get a cut, a wound, it heals really nicely. That's what we're trying to do with AnteAGE. And, AnteAGE, ANTE, we kind of talked at the beginning about, is it pro-aging, anti-aging? Well, we're anti-aging. We're really just trying to get you back to where you were before your skin started aging. So that's our whole philosophy at AnteAGE, just to get you back to that point when you were 18, 20 years old and your skin was really in ideal shape. That's what we want to do.
Okay. All right. And so where do you actually get these stem cells from? So you have a stem cell bank. What's the sort of production like? Is there a sort of a limitation on how often you can reuse this source to sort of derive stem cells from it?
On the technical side, we do. We have billions and billions of young bone marrow stem cells in our lab here. And so we go through multiple cell cycles and they get to a point where they're no longer useful. They're discarded, and then we start fresh with new cells. But we have plenty of those banked here. They do come from young consenting paid donors from a stem cell bank here in the U.S., and they're all very well characterized. We go through, we've been around for like 13 years now. So we have gone through an enormous amount of quality and safety testing here. We have genotoxicity testing, cytotoxicity testing. So we can go into all that if you guys want at some point. But we've been doing this a long time and characterizing each protein that comes from each particular type of cell. And so, the production process here with the natural growth factor and exosome products starts with those stem cells that are really well characterized from young, healthy bone marrow. And then I can also talk about, we also do quite a bit of synthetic work now, where we can actually get the exact human proteins, but we can get them from a synthetic source, from a recombinant source. And so we don't necessarily even need a human stem cell to be involved in that side of the process. And there's places like Europe and certain parts of Asia where that's the only thing that can be used, but we get great results out of that as well.
Silly question for my non-medical brain sort of whizzing away here in the background. So you're talking about the fact that you wanted adult stem cells rather than sort of child or young stem cells from a baby because the adult body is different. So is there any issues or limitations with different ethnicities? Because obviously we're all humans, but we come from different parts of the world and have nuances, but between the way we look and the way our bodies function slightly. So is there any any limitations there in terms of ethnicities and where you derive these stem cells from and who they appropriate for?
In terms of ethnicities, we don't see any different in, if it's Homo sapiens sapiens, our mesenchymal stem cells from bone marrow produce the same kind of signals. In fact, actually, even between mammals, there's a lot of conservation of these cellular pathways. So monkeys have TGF-beta3 as well. However, it is a little bit different. And so if you actually get to a different species, the morphology of those proteins, even though it's basically the same thing, it looks a little bit different. And so there's a lot of products that will have exosomes that arrive from plants or animals or fish or something like this. And while all those things have exosomes, and sometimes there's even conservation of the signals, it's not exactly the same thing. So you really, for the ideal result, for the predictable result, you want young, healthy, let's say 18 to 20-year-old Homo sapiens sapiens cell signals. That's going to give you the best result.
I've got two questions from our listeners because they're relevant to ask now before I forget them. So this is from Elise Saba. She's in Australia. What's the difference in the RNA available in each exosome? And I'm assuming different brands have different RNA sources or stem cell sources. And so, for example, are these not good for vegan patients, for example? And what about other brands where I know there's a skincare brand called Calisim, I think here, at least in Australia. It actually has stem cells sourced from deer. So how does all this stuff sort of work? And I'm not a plant, so should I be getting plant-derived exosomes?
So I'll tell you where the science is, and we're very much a science-backed, science-obsessed company. So we really do quite a bit of research. In fact, we actually have a research partnership with the University of Melbourne there in Australia. We do a lot of research there and support a PhD program there. So the science says that plant stem cells and plant exosomes don't talk to human cells. So in the same way that vitamin C might have some benefits. Maybe some of these plant-derived ingredients could have some benefits for stimulating the environment in some way, but the cell signals aren't the same. So we're not speaking the same language. When it comes to animals, as I said, there are signals that are conserved that are similar between, for instance, deer and humans, but it's not one-to-one. It's not exact. And so the farther away you get from being human, the more those signals are going to be garbled, by the distance between us genetically. And therefore, we would say that animal xeno stem cell signals, exosomes, just aren't the best choice, right? There's going to be more noise and less signal there. So we really believe that ethical, safe, human signals are exactly what we need and want when we're trying to get this optimal regenerative benefit in the skin.
Stephen, where do you see exosomes fitting into, I guess, the menu of treatments we've now got available in our clinics? We've had so many products that have come onto the marketplace, biostimulators, bioremodelers. PRP's been around for a while, but seems to be regaining some popularity, and we're refining the technique and how we capture the PRP and inject it. Where do you see this fitting in, and sort of how are you as a owner of a large practice in the aesthetic space? How are you going to, I guess, communicate this to your patients and your practitioners? I'm just keen to know where this sits in the menu.
Very good question. I don't think I have the answer for that. I'm just going to share with you and your audience where I use it routinely. I use it on every facelift patients. I use it on every facelift patient. After I finish the last suture, I would actually infuse, I will stamp the exosome throughout the entire face, including the suture line, for the main purpose of hopefully some sort of regeneration, improve wound healing. So I don't have evidence to prove that it works, because you have to do multiple randomized control trial, and I think it's a bit unethical to do it half face on my patient. So I do it on every patient. What I can tell you is, like every facelift, there will be some patient where certain part of the face, because you actually lift up the face, where the perfusion, the blood supply may not necessarily ideal in the first few days. There has been a few cases where you look at it, you say, well, maybe I need hyperbaric oxygen just to save that part of the skin. And we have been using, at least on 3 cases, stem cell on about day 3 or day 4, just to infuse it with a bit of stamping in there. And at this stage, in the last, we've been using it for about 7 months now, I have to say it has been very, very promising. We have not lost any skin. We managed to salvage area that I thought, well, okay, I'm going to lose a little bit of skin here. So that's been very, very promising. Clearly, that's anecdotal. We don't have any, ways to prove it, but I think times will tell. As to a pure aesthetic patient, and I think that's going to be a lot harder to actually prove, but what we can say is, in some patients where we routinely, let's say, do some mesotherapy just to improve their skin quality a bit, where there are situations where we really need to get them very, very well quickly. Let's say there is a, mother of the bride needs to get that skin really well in 4 weeks' time. We have seen, once again, anecdotally, adding exosome with our current regime really give them a very nice, glowing, smoother skin. So the jury's still out, but it is very, very well received to our patient who's been getting it. Because it's easy. It's easy to do.
So, surgery, that's understandable. But for your aesthetic patients, do you mean sort of post-laser? When are you actually applying exosomes?
Yeah. So we don't just apply onto the skin. We do a bit of needling because this is, after all, topical application, and just apply onto it and massage into the skin. Now, we have not tried it on, at least I'm not aware we've tried it on post-laser patient yet. But once again, with the post-laser, you should be doing a split phase using your routine topical post-laser versus exosome, and that will be the next stage we'll be looking into.
Yes, and I guess...
because it makes sense.
Yeah, we're injectors. We were just a polynucleotide launch last week. So again, there's many modalities and things that we can sort of throw, and I guess we're trying to see what sticks in a way. So do you have any sort of algorithm in your head of where you might use one, where you might use exosomes? Like, why would you choose one over the other?
Well, I think it boils down to cost, boils down to what the patient is comfortable with. So we know that on one side, the polynucleotide that we talk about is a salmon base, and this is a human base. Whenever we talk of human, there will still be a subgroup of individuals who say, well, is it safe? And Ian has kindly alluded to us that, this has come from a bank that has been clearly been screened, and the processing and all this stuff. So that's the exciting bit. But the human factor, you still need a full patient consent before they're comfortable getting it. So the jury's still out. I don't have the answer. I don't have a true algorithm of how we're going to do it and how, who are the right patient. And hopefully, with further knowledge and with input from various companies like Ian, we'll be able to come to a consensus. Because like everything, this is still fairly new. This is a very, very new field, and everyone just throw everything in, like everything. So I think at some stage, someone smart will come out to be, hey, this is where I use it, and these are the reasons why.
Yeah, I want to ask David a question. So from the lay perspective, when we're talking about stuff like stem cells and mRNA technology, does that give you any fear, any sort of ethical concerns, or is it just something that you would accept?
Me personally?
Yeah.
Oh, I mean, I'm always of the opinion I don't want to be the first.
Okay.
So I want to see how things settle, how the market responds to them, what sort of complications or adverse events sort of bear out, and why did that happen, and what are the patterns, and what's level of success. So I think that any educated patient would be excited but also cautious around new technologies and what are the long-term results and complications potentially going to be.
Yeah, fair. Yeah. How would you counter that, Ian? I mean, do you get pushback, patients a bit fearful, anxious? They've heard about vaccines, etc., and mRNA technology. So how do you sort of counter that and explain it to people?
Yeah, absolutely. So, I've been in this stem cell product space for 13 years now. So definitely in the early days, there was a lot more conversation. I would say that now, at least in the US, and I've been to Australia and I've spoken to practitioners there as well, these growth factor products that I've had in the market for a decade are pretty well accepted now. Most people aren't scared of growth factors. Growth factors, that's been around forever. That's safe. We get it. But now we have these new exosomes. This is the new thing. But exosomes, it's just a derivative of growth factors. It's just another way of delivering growth factors. As I said, it's higher signal to noise. But this is where people are having conversation because it's a newer thing. These products have been around now for a few years. This product actually we launched 2 years ago in Dubai, did our initial kind of beta testing there, and it's been in the US for a year now. So, I've got many thousands of practices that are using this in the US on, well over 100,000 patients. The results are universally very, very positive. No adverse, definitely less adverse than you would see with a lot of, I would say, more classic cosmeceutical products. Because they're so biocompatible, they're so bio-native. We're just concentrating the good things that are floating around in healthy tissue. Yeah. So for that reason, I can stand behind the products really strongly, and I can tell practitioners, look, believe me or don't, you test the products out, give them a try, and I know you're going to use them and love them. And that's what we did with Dr. Liew. Said, hey, would you like to try this? And he's finding good applications in his practice, and that's just pretty universally the case. Just yesterday, I had a call with a group of med spas in the U.S. that has 30 locations. They've been using our products for a little over a year now, and they said, look, every time we add a new location, a new practitioner, it's so easy for us to get them onto AnteAGE. They use the products, they work really well, the patients are happy. It's kind of simple. So again, I think we can answer that, that kind of fear question. Oh, is this safe? Is this humane? We really have all, if you want the white papers, if you want the genotoxicity studies, we can give you all that kind of level of comfort. But ultimately, we've been around for 13 years and the results are really good. And that's I think, what kind of gets people over that hump of like, okay, the results are good. Hundreds of thousands of people have used this over decades. It's got to be good stuff.
Stephen.
Dr. Liew.
I think Ian forgot to mention the thing that attracted me is it's actually 10 billion exosomes in this tiny little vial, right? I mean, if you look at it, it's nothing remarkable. It's almost like the back of a anti-wrinkles, where it's like, I can't pronounce the word, Ian, you're going to start with an L, lyophilized.
Lyophilized, yeah.
10 billion exosomes in this thing. It's almost like we're receiving 10 billion text messages to various parts of your cells, each doing a different parts. I think that's important to know. I think I also want to clarify to your audience, when I use the analogy of vaccine, as Ian kindly, we're not producing a new protein. We're not asking your body to create something that's foreign. We're asking your body to create something that they normally create, but create a lot more to actually achieve that, a better quality skin or better wound for wound healing and those sort of things. That's important to know. And the third thing is, to answer your question, David, is I don't see myself as someone who want to be the first in everything. And I think with exosome, as I said, it's not an overnight thing. I've been thinking about it for more than 30 years. Of when that opportunity come along. And yes, there are a lot of exosomes out there. There are plant-based exosomes and all that stuff. And for me, it's always been, you've got to have something like with life. We are Homo sapien, right? If we can get something that is almost identical with what our body is composed of, that has to be the first requirement. So now that we have overcome the issue, what I'm looking forward to is more of a synthetic exosome, so that we can overcome the legislation that we can't actually use human body. Because I'm looking forward, the next step is basically injecting it into the tissue with a synthetic. And that, I think, will actually get a much, much better result. Don't also forget that plant-based stem cell skincare has been around for 15, 20 years, right? I remember 20 years ago, I thought it's pretty good. It come from Apple. I've been buying it. It cost me $500. I mean, thinking back, that's quite a naive thinking.
Yeah.
It's an Apple. We're not made of apple. The last time I looked, just like you, when I cut myself, it bleed. So, I think we advance forward, and that's always been my thinking. In summarizes, so far, none of the patient from the aesthetic has actually said it didn't work. It's always been an extremely positive response. So it's one of those things, if you've done all the due diligence, I know it's safe, it's not going to create any harm, I'm going to try it.
Yeah.
And we did.
And just to remind the listeners, every day you're injecting bacterial toxins. If you're dissolving fillers, you're using, at least in Australia, sheep-derived enzymes from testicles. And if you're injecting HA filler, it's bacterial fermented sourced hyaluronic acid. So it's a little bit silly to get funny about one thing and be comfortable with another when you think of it like that. So, yeah.
Ian, when you are doing your trials and you're talking about results, what are the indications? What are you actually seeing when you're doing these trials on these patients? And I want to get Stephen's perspective as well. I know you've been talking about the results from facelift patients, but from your average aesthetic patient, what are you noticing? Just walk us through the process of what the patient experience is like and what kind of results you're seeing, how long it takes, how long it lasts, just the sort of general application questions.
So my typical aesthetic patients that, we want to improve their skin, the appearance of the skin, they will see one of my staff, Nikki. Nikki will do the usual cleaning and then, will infuse some of the stuff, whether it's HA or anything like that, through after needling. In some patients who can actually would not mind paying a bit more and have a deadline, and we will also infuse the exosome in there. And what we see at 3 or 4 weeks coming back, they have this amazing smoothing, glowing effect, which we did not see with our current regime, right? So I'm not saying it definitely worked. It could be this particular patient just worked so well with the current regime, which is not seeing it. But this is a very consistent thing. It's almost like, being someone who's actually very critical, and I don't give a lot of compliment, and I'll say, wow, pretty good, right? So those are the things that we are seeing. So hopefully we can actually present a series to the audience, in the coming months of what we're seeing.
I'm guessing in a clinic like yours, Stephen, you've obviously, probably done clinical photography, but have you also done anything like Visio? Can you actually look at some parameters?
So we have 3Ds, and we don't have Visio because it's broken.
Right.
With our, I like photography, and the lens that I have costs a lot more, costs about $5,000. So I can actually zoom in to just one square to actually have a look at that. And then with the Lightroom thing, we can actually look at the melanin, look at the vascularity, look at the pore size. So that's actually been very, very impressive.
Ian, did you want to sort of address that same question as well from your perspective?
Yeah, so I see doctors using these products primarily with modalities like microneedling and RF microneedling. That seems to be the most common. And what are you trying to do with those modalities? You're trying to rejuvenate tissue. You're trying to get new collagen growth. And so in using these biosignals, growth factors, exosomes, you're going to enhance the results of those particular treatments. What Dr. Liew said about this kind of healthy glow where the skin just looks good, it's just this intuitive thing where the skin color looks smooth and even, it's healthy, it's got glow, luminosity. Those are the kinds of effects that we tend to see, and that's what you're trying to do with the treatment. But you're putting fertilizer on it when you're putting these growth factors and exosomes on. You're just going to get a much better result, better than you could get with the treatment alone or with using a more basic topical.
I still want to fully understand the difference between your skincare, which has growth factors, and your obviously application of exosomes. They're different. So what is the protocol? Like, how many exosome type treatments would you do post needling versus what's the protocol at home for the skincare?
Yeah. So we actually started with skincare. So 10 plus years ago, we started with our serum and accelerator skincare. So this is really like a complete anti-aging regimen. It has all of the classical actives plus the growth factors. So that alone is going to give you a really great anti-aging benefit at home. And we like seeing that in between in-office treatments. And we all know that you're going to get the most amount of change, the most bang for your buck when we're doing in-office treatments that are a little bit more aggressive, maybe something non-surgical like an RF microneedling. So then we have actually various treatment products that are growth factor based that are for microneedling, for RF microneedling. So you can use these growth factors at home, you can use them in the treatment room, and then the exosomes is just a more concentrated and aggressive way to deliver those growth factors. So that's kind of where the growth factors fit in. And now we're actually in process of putting our engineered exosomes. So Dr. Liew kind of alluded to what's in our R&D pipeline, having synthetic human exosomes. And 6 months from now, you'll see all of our home care products actually have those synthetic exosomes in them as well, because they have to be really carefully engineered to stay preserved at room temperature. That's a really good trick. And so that's something that we've developed in our lab, as well as the ability to have synthetic exosomes preserved at room temperature that you can have in a home care product. And that's only going to complement the highly concentrated products that you're using in office. Whether they're synthetic or human derived, you're getting a lot more concentrated effect and more purity with the products that are being used in the treatment room.
Okay. And if you have a patient who have a particular complaint like pigmentation or rosacea or whatever, do you have a particular exosome or a particular growth factor sort of packet that targets that, or is it just a generic blend?
Yeah, we do. So the biosignals tend to be kind of the same, like let's say if we're treating pigmentation. However, we can bring other really good actives in combination. So, when we have pigmentation issues, they tend to be driven by inflammation, right? So growth factors can address that. But then why not also use tranexamic acid? Tranexamic acid is this great, also anti-inflammatory ingredient that can help regulate pigmentation. And there's other aspects of the tyrosine pathway that we can short circuit to ultimately come to a blended topical that has growth factors, that has exosomes, and then it has all those other really good actives in an easy to use treatment that can be used in clinic. So yeah, that's our brightening solution. Hair is kind of a more complex story, but we also have products that are used in hair treatments in clinic and home care products of the same. So yeah, we like to put together kind of complete solutions that has all that growth factor exosome signaling, but then also has all the other classical actives that are really beneficial for the skin.
Stephen, do you know if anyone's actually in Australia used these products via injecting? I know that we're not allowed to because they're human based and we're not allowed to, human derived, not allowed to. But do you know, or Stephen in the States, have you seen the results of injecting the product?
I have seen a few colleagues in America doing it. It's almost like percutaneous injection using a needle that's 1.5, 2 millimeters just to get within the dermis. But in Australia, I have not heard of anyone doing it yet. I think this is, AnteAGE in Australia is still fairly new and fairly unknown compared to a lot of the other plant-based exosomes. So, I'm sure, but I think we need to be quite careful because this is not this is still being approved for a topical thing, particularly with the current guideline. I think we all need to be a little bit less gung-ho and just see how this pans out. Yeah.
What results would you expect to see from the injectable version as opposed to the topical based?
Well, I guess the delivery will be much better, isn't it? You actually delivering. It's almost like I'm going to text you directly via text via Jay, so that Jay can pass on the message to you. So I just think it's always been, if we can get it to the target organ, I think the result ought to be a lot more impressive.
Yeah, it seems to be a sort of a technicality, and of course we have to respect the laws, TGA, FDA, etc. But I think what Stephen is saying is you want the product where it needs to go, but it's only approved, at least here in Australia, for topical application. But intuitively, you're making microchannels to get it into the dermis anyway. So logically, this would be very off-label, but you could technically inject it.
Yeah.
I think that's what we're sort of saying.
Yeah. I mean, Ian, what are you seeing? I mean, you've got different laws in the States. I'm not sure whether you're allowed to inject it in the States, but I know there's some human-derived products that I've seen on the US market. So what have you seen from a clinical perspective when you inject it as opposed to skin needle it or microchannel it in?
Yeah, so addressing the regulatory side, there are no exosomes in the world that are approved for injection.
Right.
So whether it's U.S., Europe, Canada, Australia, none of the regulatory bodies have accepted an injectable exosome to this point. I think there's going to be a pathway for that, and I actually think it's going to be in Europe first, and we're studying it for Europe. The MDR, the new MDR annexes there have a little bit more of a straight path for that. So we're investigating that, and I think the appropriate way to do that is with the right IRBs and the right science being studied in vitro and in vivo, until we can get to a point where we can tick all the boxes and really have a notifying body, a regulatory body do that. Now, of course, there are exosome products that that I'm aware of in the States that have been advocating for injection, and so there. For more than 10 years, there's been people who have been injecting exosomes, and there's a lot of anecdotal evidence out there that there's benefit of that. I mean, you even mentioned Joe Rogan, talking about these things, and he's had exosomes injected into his knee. Actually, my father has had exosomes injected into his knee as well. So there's lots of different applications that are being studied for medical uses as well as for aesthetic uses. But as of today, we can really only talk about topical, cosmetic, and what the outcomes are there. And the outcomes are really good. So that's why it definitely merits further study for other applications.
Yeah, feels like this is just the beginning.
Yeah, as not funny, but when I went to AMWC Miami, which was last February, talking to a lot of these companies producing exosomes, etc. Not yours, I didn't meet yours, Ian. And one of the doctors was very proudly stating that he does IV exosomes, which I thought was very brave. And I asked him how his insurance company feels about that. And then he walked off. So please don't do that. It's highly off-label, and stick to your own local regulation.
Yeah.
Ian, I wanted to ask you, so we've mentioned growth factors, you even named some of them in your sort of preamble, but how easy are these to preserve? And one of the criticisms that I've read, I don't know if it's true or not, is that, do these absorb into the skin properly in a topical? What's their shelf life? How easy are they to preserve? And what do you have to do what's the medium that they're actually in? What chemicals are in your skincare?
So the answer is that, of course, any protein is going to degrade over time. And so we have a lot of complex cosmetic chemistry and bioengineering in trying to extend the life of these proteins so that they're still active and they're still having a benefit over the shelf life of 2 years. So that has to do with the lipid chemistry and how we encapsulate them. And it also has to do with how many we put in, and we know there's going to be a degradation curve, just like any active ingredient. From the day it goes in the bottle, it's starting to have less and less effect over time, but you want it to still have the benefit that you're conveying by the end of the shelf life. So that's mostly in the cosmetic chemistry. But then how does it actually get into the skin? Well, there's a lot of shepherding molecules that we can use to help get these proteins into the skin. And even honestly, our pores take in things all the time. You can put all kinds of transdermal patches on to infuse things even into the bloodstream. We just need to get these proteins into the skin, just beyond the dermal epidermal junction. And that can be done with shepherding molecules, and that's all part of the cosmetic chemistry.
Do you ever see non-responders to these treatments? And if so, is there any sort of particular patient profile or commonality between these people that just don't seem to get any benefit?
The way I think about it is, everyone's kind of pushing against their own inertia, right?
Yeah.
And so if you're a smoker with hormonal issues, you have autoimmune issues going on, you've got a lot of inertia that you're pushing against, right? I think that in all cases, because these are natural biosignals and we're really just trying to restore the optimal, healthy, young human biosignal complex, we're always going to be moving someone towards healthy. But some people are, they're pretty far along the road, and it's just going to take a lot, right? It's maybe going to take some lifestyle changes in addition to topical products. But someone who is kind of working with us and, trying to have a generally healthy lifestyle, they're wearing their sunscreen, they're drinking their water, they're exercising. If they're also then using good topical skincare that has biosignals in it, then they are going to have that optimal outcome. I can't really say there's like one group that's more or less responsive, except I will say that people who are older, let's say over 30, which is certainly going to be most of our patients, they are going to see more of a benefit because they're kind of farther along in the aging process. And so they really benefit more from these anti-aging proteins. Someone who's 25 years old, they just don't have the deficit. And so they don't have as much of the benefit from restoring those signals.
Yeah. Stephen, in your clinic, I don't know if you guys have devised any protocols of sort of how many treatments you recommend for needling or radiofrequency needling, how many times you apply the exosomes, and maybe give us an insight into sort of the business aspects, like what does it cost for the patient?
For us, depends on the event. So normally we would actually ask for 2 sessions. Mm-hmm. And it's interesting. Some patient after the 2 sessions will ask for the 3rd. Mm. So in general, 2 to 3 sessions is what we normally recommend for the patient to have. The best thing to actually do it is for those of you who've never done it, to actually do a bit of needling on yourself and try it. You'll be amazed what the skin's going to look like. And that's how I think we all, at least in my clinic, how we actually kind of see what happened and be quite excited about it. And don't forget, in my clinic, we have a lot of personality, and they're all skeptics like myself. I remember there was a few years ago when I bought this machine straight from LA. All of them thought I have become sort of gone crazy and demented. And then after 3 months, they were all convinced. So, I think I'm excited. I'm an optimist, and I actually see a great potential in this. And we just need to get the next bit on having a much better control studies to actually prove that it is, efficacious as what we have seen. Mm.
Do you actually put the serum on the skin and microneedle it in with a roller, or do you do the microneedling first?
We do both.
Right, okay.
We do both. We do the microneedling first, and then we apply it and roll it in.
Right. So you mentioned earlier, you showed us the vial. So in there, it looks like an anti-wrinkle sort of product with a freeze-dried thing at the bottom. So how do you turn that into a liquid?
So think of it as your anti-wrinkle. You have your saline, and this happens to be HA.
So you put it in, HA, right.
Yeah, this is a diluent. You just actually mix it in and actually dilute it in. It's very, very simple.
Okay. Yeah.
It's very, very simple. And this is a 5 ml. And you can use the entire 5 ml, or you can use an even more concentrated form.
Right, okay. So Ian, why can't you have it pre-made? Why do you have to sort of make a little cocktail at the bed?
Well, exosomes are very delicate. And that's why, these products that are room temperature that have been around for a long time, they're not exosome products, because exosomes pop at room temperature if you just leave them out for a few hours. So this lyophilization process we go through, this freeze drying, actually creates a crystalline structure. And that crystalline structure keeps the exosomes from denaturing, keeps those little fat bubbles from falling apart. So that's why they need to be kept freeze-dried until they're ready for use. So we take this hyaluronic acid, which has some nice properties on its own, and we use that to reconstitute, to liquefy the exosomes. And then you've got, this liquid solution, whether it's 2 mLs or 5 mLs, however much you use to dilute. And that's good for a few hours. So, once you've re-liquefied this, you want to use it within a few hours on the patient.
Right. And does it need to be refrigerated before you reconstitute it, or
not before. So actually, we've now done heat studies on this, and it can survive transport across the world at fairly high temperatures. Once you've lyophilized this properly, it's very, very stable at all temperatures. And then once you've reconstituted it, it's fine at room temperature for a few hours.
Great. This was actually another question from Stephen Land, one of our patrons in the UK. he says the theory behind exosomes seems sound, but the research is potentially lacking. So do you guys have clinical studies, papers, anything that you can provide us that we can sort of distribute amongst our Patreon community?
Yeah, absolutely. So we have a white paper on our exosomes that's fairly comprehensive. So all the proteomic studies, we have cryo, TEM, electron microscopy. We have functional studies as well as case studies. Now, if you're looking for the full clinical study, with a high N and all the statistics done behind it, that's actually in progress. So these products are fairly new, and they're actually even still in development. We're already on version 2 of this. So for that reason, we needed to get to the point where we had enough, let's say, market experience, and we kind of knew that, okay, this was the final version before we start doing those more expensive, very expensive clinical studies that are going to be published and whatnot. But till now, we've got great case studies. We've got, again, thousands of practices that have already used these on hundreds of thousands of patients now. And so we can provide you with all those case studies as well as the in vitro work and all of the scientific functional analysis.
Yeah. Couple of business questions for you. Ian, I know Stephen said he's not familiar with prices, but I guess in terms of what you recommend in terms of retail price and what it costs, what are the margins looking at? Because, a lot of the questions that come up with practitioners is, how much is it going to cost? How long is it going to take me to do? How does this compare to other treatments I might be able to provide in my clinic? So there is a commercial element to this as well. So can you sort of shed some light on the commercials on this?
As you know, it really depends a lot on where you're at in the market, what city you're in,
Sure.
What demographic your practice is targeting. But let's just say somewhere in the $500 to $1,000 range.
This is US dollars?
Probably going to be, a single. That would be Australian.
Okay, sorry. Yep.
So somewhere in that range, let's say 500 to 1,000 per treatment. That's going to, really vary a lot depending on what kind of treatment are you using, standard microneedling, RF. But let's just say that's probably like a typical range. And the nice thing about this, though, is simplicity and time. So let's think about PRP, where you've got to draw blood, spin blood, et cetera, et cetera. You've got to use that kit and then deliver it. This really is, you draw up the diluent, you put it in the exosome, you shake it, and it's ready to use, right? So we've taken, all that work of getting these youthful biosignals in exosomal form, that kind of digital, highly potent form, and it only takes a minute really to prepare the product.
Well, we should have actually asked the question, how do you sort of contrast PRP versus exosomes? Like, in layman's terms, are exosomes PRP on steroids, but obviously from a different source, or are they just different? And would you recommend both, or do you think that yours is superior?
They are different. I mean, PRP is a technology that's been around for a very long time. And it is certainly part of the, let's say, the bread and butter mix for a lot of practices doing regenerative treatments, right? This is kind of the OG regenerative treatment, PRP. Now, the way I think about it is PRP is only as good as the signals that are already inside of your patient, right? So whatever's going on in that patient, whatever they had for lunch, that's going to come out in the signals that you're concentrating. Now, I think there are some positive applications, but in general, I would rather know what those signals are going to be. I'd rather have them from a consistent source, the bone marrow stem cell, where I can characterize them, and it's always going to be consistent. PRP is never going to be consistent because your patients are always going to be highly variable signals that you're going to get from them. And then the process of making PRP also has some complexities, and not all kits are made the same. So I just think, if you want something that's more consistent and more ideal, something like a growth factor or an exosome is going to be that.
Sorry, and I think I might have missed part of the answer there. So you're saying that the average practitioner or clinic in Australia would charge between $500 and $1,000 for the treatment. If we're looking at how long it takes to do microneedling, we're probably looking at, depending on the size of the needle, if you're using numbing cream or not, let's call it like maybe half an hour to an hour, potentially, depending on the patient, how many areas you're treating. So what do they actually buy the product for? I'm trying to ascertain, like, what kind of margin are we looking at here for practitioners?
So I actually don't know the per vial price in Australia, but I'll say this: your margin. Let's say if you're charging $500 a treatment, your margin could be 5 to 10x on the product. So you're getting healthy margins for sure. These while they're exotic, there's still plenty of room for profit margin for the practice.
Awesome.
And do you sell sort of a little box of exosomes? Like how many do you get in a box?
This is my box. It comes in a box with 3 treatments. So you're getting 3 exosomes and 3 diluents. And then the growth factors come in a box of 5. So, again, you're kind of analog and digital. If you want to use growth factors, that's going to be maybe for your more cost-sensitive patient, or just someone who wants kind of an entry level, and then maybe they can upgrade to exosomes later. Yeah. And then the high potency stuff is going to be the exosomes.
Right. It's exciting stuff. And you say the synthetic is 6 to 12 months down the pipeline, right?
Yeah, so we call that biosomes. Yep. And so we have a exosome PhD who's been hard at work for a year developing this nanotechnology to be able to deliver room temperature exosomes in solution for home care.
Right. Well, I think we might have to have another discussion in 6 to 12 months' time. I'm sure Stephen's going to love to tell us all about the synthetic version and what he can do with injecting it. So I think there could be room to do a series of these discussions, because I think there's going to be some amazing breakthroughs and sort of advancements in how we're delivering these. So I'm excited, Jake.
It is exciting. I'm just looking through the listener questions. I did certainly one more. Applications for hair loss. We did touch on it. You said it might be more tricky, but what are your thoughts and recommendations?
Yeah, so we've actually had a product called AnteAGE Hair Solution for a number of years. We have separate studies on that and white papers. It's a whole different area of technology. We do WNT signaling, which I'm sure all of your hair folks, their ears will light up with that. But we also are very close to launching a hair exosome. So this is hair growth factors. The hair exosome will be coming out in the next couple of months. And that has a whole new layer of technology and kind of added signal and power. So yeah, you absolutely can use growth factors to be a part of hair treatment. And exosomes are also a very promising part of that.
Oh, I might
was going to say, let's get David signed up immediately. What does the protocol look like? Is it sort of a stamping gun to make it more tolerable?
Yeah, there's various ways to do the treatment, but again, PRP is kind of the OG here, and so we can use these products in similar ways. Stamping, needling is often a modality that's used as part of a hair growth regimen.
Fantastic. I'm pretty sure we've answered all the questions. I'll just give a shout out to the people who've sent the questions. We had Jamie Urales, Leslie Scott, Iman Joshi, Dr. Rupali Kashyap, and I think that's everyone.
Well, Dr. Land you already mentioned him.
And Dr. Land, yes, of course. So any advice on practitioners how to market these treatments? I mean, of course, look at your own, protocols and regulations of what's allowable and what's on label, etc. But how do you suggest a clinic sort of introduces this, and what are sort of the buzzword terms that patients would understand?
I think that regenerative is a good way to describe these treatments. We're looking to regenerate, to bring back the youthfulness that we lose over time. So that's my favorite term when we're talking about what these things are. You can talk about regenerative, growth factor, stem cell. Some of those things start to get you maybe into trouble depending on what the TGA likes and doesn't like in terms of technology descriptions. But I like regenerative. Dr. Liew, what do you think?
Well, we specifically have not advertised or marketed because of the guideline is still very gray. Being a plastic surgeon, we were the first group to be targeted or not targeted,
affected,
observed and watched by the regulatory body. So we've been very, very, very strict on not saying anything. I mean, are we allowed to use the word exosome? I'm not sure. Probably not, because we can't technically, Jake, you probably know this. I don't think we're allowed to even talk about PRP, are we?
Yeah.
Because we cannot talk about the content of what we're using.
Yeah, it falls into a funny grey area of PRP, and I don't want to misquote that.
So at the moment, we certainly can't talk about stem cell therapy, which is a buzzword that audience or the general public will understand. It's a sexy term. So at the moment, we have not. So it's just mainly in-house, word of mouth, and all this stuff. So I think this is a very, very dangerous period for us that we're all really, quite sort of concerned.
Yeah, I'm sort of curious to know what Nikki and the team sort of say. Oh, hey, we're going to do your needling today, but we've also got this exosome stuff.
I mean, I think in-house, we can actually use the word because it's you're not advertising it to the public.
Yes.
Right. Just like in-house, you can actually talk to the patient.
Yeah. Okay.
That we are using this thing, which is, derived from the bone marrow and, the safety and all this stuff. And this is what we're going to use.
Okay, fair.
Did you have any questions that you wanted to ask Ian? Stephen, you mentioned at the beginning of the podcast you had a few of your own questions. I know there was a few questions you asked during the chat. But is there anything you wanted to sort of query before we sort of wrap things up?
I think Ian covered it very, very well. And I'm just quite excited about the 6 months that we'll be able to get the synthetic, the biosome. So I'm looking forward to it. I'm more interested, not for this audience, the detailed technicality on how you guys actually create that bit.
Yeah, well, maybe we'll do an IA trip to Irvine, California. I was actually there last year. I should have come, but I didn't know about you guys then.
You guys are more than welcome.
That'll be fantastic. Stephen, I've got one last question for you. Do you think we're only scratching the surface of non-surgical?
Oh, yeah.
Like, where are we going in the next 10 years?
Oh, I think there will be more refinement. I think, as I said in the beginning, there'll be some clever people who actually perhaps even do some controlled prospective studies.
Yeah.
On all these individuals, maybe even a split face, if that's at all possible.
I think I've shared this on the podcast once before. I don't know if you can see these scars on the inside of my arm. I've got a little triangle with 3 dots here. And
you're abducted
here
by
on
aliens?
this side. Well, nearly. When I was a poor medical student in Manchester, UK, I volunteered. There was a biotech lab right next door to the medical school, and they were looking for guinea pigs to make scars on, and then one side was treated with some magic concoction and the other side was the control, and I couldn't notice any difference, but I got paid as a poor medical student to fund my studies. So
I don't want to know what else you did.
Ian, if you're looking for some guinea pigs again, we'll fly over and you can cut us open and see what happens with your scars.
All right, that's a deal.
Fantastic. Well, guys, thank you so much. I really enjoyed that chat and I've probably got lots more questions. We do have an offer from the AnteAGE team who are here in Australia. So they will be at Cosmeticon, which is early March here in Double Bay in Sydney. And for the first 50 people who go to their booth and quote that you listen to this podcast, you'll get 50% off one of their kits.
Ooh.
So exciting. So go and check it out. Go and see Diana Sestan from the AnteAGE team.
Fantastic. Thank you, Ian. Thank you, Dr. Liew. Stephen, thank you for coming on and telling us all about your product. It's an exciting part of the industry, and I think, as you said, we're only at the beginning.
Yeah, and we'll obviously put the details of AnteAGE at the bottom. If you can't go to Cosmeticon, you can just contact them directly.
Lovely. Thank you, guys.
Thank you very much, guys.
Thanks, gents. Have a great day, and hopefully we see you in person soon.
Bye-bye.
Cheers. Have a good one.
For our latest news, follow us on Instagram at Inside Aesthetics Podcast. If you want to get in touch with myself or David, follow us on Instagram as well at Dr. Jake Sloan and David_Inside Aesthetics.
Join our Patreon for invaluable business and injectable education. Get access to our global community of like-minded professionals, live and interactive Zoom sessions, hints and tip videos, webinars, and more. Head over to www.insideaesthetics.com/Patreon for more information.